As we continue with our trauma education, we're going to show you the T-POD pelvic stabilization device. It's a pelvic binder for the management of pelvic fractures. The reason that you put these on is because the patient is, well, we're not going to be putting them on. We're probably going to be removing them because they've been put on in the field with a patient who has obviously a pelvic fracture, and the biggest concerns with pelvic fracture is bleeding, severe amount of bleeding, and pain. They are in severe pain. So this is a much better device than the old mask trousers, which were very difficult to get on and very difficult to get off. So when it's put on the field, they slide the belt under the patient when they're in a supine position, under the pelvis. You bring the belt around and you leave a 6 to 8 inch gap over the center of the pelvis. The device has sewn in quilting, and you can cut it down any of those. It's not going to unravel or anything. You then apply the Velcro-backed mechanical advantage pulley system to each side of the trimmed belt. You slowly draw tension on the pull tab, creating simultaneous circumferential compression. You secure the Velcro-backed pull tab to the belt. You record the date and time of application on the space provided. As you can see in the picture, there's bursts where there's bleeding in the pelvis, and after the application is on, then there's no bleeding noted in the pelvis. Considerations are, if it's an obese patient, it requires T-POD. 2 belts may be affixed together using one power unit as an extender and the other as the pulley. You monitor pulse and blood pressure in accordance with your organizational protocols. T-POD should be replaced when soiled or after 24 hours of use. Place Foley catheter prior to application as needed. Children under 50 pounds may be too small to obtain the 6 inch gap needed for closure. Reapplying the T-POD, circumferential compression should be released every 12 hours and check for skin integrity and provide wound care as necessary. To retighten, draw the Velcro back pull tab, secure and attach to the belt. T-POD release time should also be noted on the label. The benefits of splinting: it applies compression, leaving less space for the blood to accumulate. Tamponades bleeding sources such as fractured bony surfaces or ruptured vessels. Reduces instability of the injured pelvis, prevent further damage to the pelvis, organs, and vessels, and reduces pain by limiting movement of the pelvis. And now I'm going to show you how it's applied and how it will be released. This is the pulley device. The belt obviously should be lying down when it's put on, and it's brought around. I'm going to fold it for purposes of demonstration and not cut it. Okay. Just don't put it here. Right. It's here. Okay. You'll release that. You pull this slowly. Feels pretty good, doesn't it? Mm-hmm. Tighten that up. And then to make it stay, you put it in little holders around the edge. And then you put this back and it holds it as tight as it needs to be.
Do we need to go around all 4?
You don't have to, because you just would it as long as you have enough for it to stick to the Velcro. When we get the patients in the operating room and we need to release it, we're going to pull the tab, unwind it, and you need to be holding pressure on this because you don't want it to release suddenly all at one time, okay? And you release it slowly as well, this just like you would do the tourniquet. And that's it. And this is a one-time use as well.
Okay, so they could just cut the strings all the way up to get it off the patient easily. Just let the sides fall back.
No, because you have to release it slowly.
After you release it,
oh,
you could just...
Well, you can just do that.
Yep. Okay.
Because it's just